Hello, my name is Gwendolyn Kukel, and today I'll be presenting my community analysis on Black women in the United States as a vulnerable population. I chose this population for my analysis because Black women frequently remain unrecognized to this day in many discussions surrounding racism and sexism. Despite experiencing a distinct intersection of both forms of the discrimination concurrently. And what this means is that Black women often carry a compounded burden of inequalities, facing barriers not only because of their race or gender individuality, but because of how these factors intersect and intensify one another in daily life. To help organize this information in a clear and engaging way, I've created this presentation for you to follow along, not only to share my analysis, but also to provide visual support that makes the key themes and data easier to follow. This presentation will follow the macro practice framework from our textbook, looking at the dimensions of the community, their assets and challenges, power structures, social problems, and potential strategies for advocacy. Black women represent such a powerful and resilient group, yet they still face systemic oppression that intersects across race, gender, class, and other identities. It is my hope through this analysis that I can highlight both the challenges and the strengths of this community and how social work can play a role in advancing equity. When we define the community of Black women in the United States, it is important to look at multiple dimensions. Black women are not a homogeneous group, but a diverse one that includes African American women, Latino American women, Caribbean women, Afro-Latino women, and those of mixed heritage who identify as Black. Their community functions not only as a cultural group, but also as a powerful source of resilience, advocacy, and collective identity. Those words you're going to hear a lot in this presentation, and they're very important. Churches, civil organizations, and family networks often serve as strong community anchors for these women. Intersectionality also shapes this community's dimensions, as Black women experience overlapping oppressions of, again, race, gender, and class that creates unique challenges and identities. But beyond demographics, it is important to recognize the functions this community serves. Black women contribute significantly to the social, cultural, and economic fabric of the United States. They are often at the center of family life and caregiving. They are central to faith-based institutions that provide both spiritual and material support. And they're great at driving social movements and advocacy for racial and gender justice. In the workforce, Black women are vital contributors across healthcare, education, business, and public service, even while continuously facing persistent inequalities. Culturally, they preserve and expand traditions, again, of resilience, creativity, and leadership that shape American identity. These functions demonstrate how the community not only survives in the face of systemic oppression, but actively creates networks of support, leadership, and innovation that benefit society as a whole. According to blackdemographics.com, as of 2023, there are about 21.1 million Black women living in the United States, which accounts for over half of the Black population. The median age of Black women is 37.6 years, slightly younger than the median age of women in the US overall. Geographically, large populations of Black women are concentrated in the South, in states like Georgia, Alabama, Mississippi, but also in major urban centers like New York City, Atlanta, Chicago, and Los Angeles. Culturally, this community has deep roots tied to African American history, spirituality, activism, and the arts. These cultural elements continue to shape identity and provide a foundation for resilience and community organizing. Despite their resilience, though, Black women face significant challenges. Economically, according to the U.S. Census Bureau in 2020, Black women working full-time, year-round, earned 63 cents for every dollar earned by white, non-Hispanic men. So I think it was 63 cents less for every dollar earned. That translates to about $5,500 less annually than the national average for women. This wage gap contributes to higher poverty rates, with the U.S. Department of Labor in 2022 reporting that nearly 21% of Black women live in poverty, compared to 13% of white women. In terms of health, disparities remain especially concerning. The Centers for Disease Control and Prevention in 2021 reports that Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women, and are disproportionately impacted by conditions such as heart disease, diabetes, and breast cancer. The criminal justice system also affects this community disproportionately. According to the Sentencing Project in 2020, Black women were imprisoned at a rate of 1.7 times higher than white women, which is tied to systemic inequalities in policing and sentencing. There are even more challenges that the Black women face that are well documented throughout national data that I haven't been able to include in this slide, but these needs reflect both systemic discrimination and inequitable access to resources, underscoring why social workers must focus on this community with intentionality and advocacy. Even while facing systemic barriers, Black women demonstrate extraordinary strengths and assets. In this community, in my community and in the Black community overall, resilience and cultural strengths are central values. Black women often rely on mutual care networks, community-led doulas and midwives, and ancestral healing practices, strengths that flourish even amidst systemic barriers. Historically and today, they have been at the forefront of leadership and activism. Leaders like Stacey Abrams, Congresswoman Ayanna Pressley, and Congresswoman Cori Bush represent the power of Black women in shaping politics and policy. In arts and media, figures like Beyoncé, Ava DuVernay, and Shonda Rhimes use their platforms to highlight issues affecting Black women. Community institutions like church, nonprofits, and those grassroots movements provide essential support and advocacy. And most importantly, the community values resilience, cultural pride, and collective identity, which serves as sources of empowerment and healing. Black women's well-being is supported and shaped by both formal leaders and policy initiatives at the federal and state level. In Congress, Representatives Alma Adams and Lauren Underwood co-chair the Black Maternal Health Caucus, which has been central in advocating for the Omnibus Act, a package of bills designed to improve maternal health outcomes and addresses social detriments of health and increases workforce diversity. Several senators are also leading efforts. Senator Kamala Harris sponsored the Maternal Care Act, which funds implicit bias training for providers and pregnancy medical home programs. Senator Elizabeth Warren has proposed linking hospital reimbursements to improved maternal outcomes with the goal of reducing racial disparities. Newly elected leaders such as Senator Angela Alsobrooks of Maryland, a member of the Congressional Black Caucus, are also bringing attention to equity-focused health initiatives. Policy shifts are beginning to make an impact, though. The Omnibus Act has already seen parts enacted, such as the Protecting Moms Who Served Act, which improves maternal care for the female veterans. States have also expanded Medicaid postpartum coverage to 12 months and are increasingly reimbursing the doulas and midwives or the community health workers for their services. Innovative state programs like Connecticut's Maternity Care Report Cards and Philadelphia's Joy Blank program also provide financial support and doula services to pregnant residents, also while emerging as models to address systemic inequities. The power structure within the Black women's community is shaped by both formal and informal leadership. Formal leaders can include elected officials like Ayanna Pressley and Cori Bush, who directly influence, policy, while informal leaders often include our pastors and our grassroots activists that we spoke about, and community elders who can guide, support, and mobilize people locally. Policies also deeply impact this community. For example, housing redlining created intergenerational wealth gaps, unequal pay laws, perpetuating wage disparities, and restrictions on reproductive health care, which disproportionately affect these Black women. These policies illustrate how systemic forces continue to disadvantage the community while reinforcing structural inequalities. As you can see, I like graphics. So let's move on and dive a little deeper into the community's formal and informal resources. On this slide, I'm focusing on the structure and capacity of resources within the community of Black women in the United States. First, we can look at the formal resources. On the left side, we see organizations and leaders that hold recognized positions of authority, such as the elected officials, the policymakers, and the established advocacy groups. Groups like the NAACP or In Our Own Voice. These leaders work to influence systemic change, particularly through policy reform. In areas like reproductive justice and civil rights, and their influence often shapes the laws and institutional practices that directly impact housing access and healthcare equity and economic opportunity. On the other hand, on the right side, informal resources play a critical role in service delivery and community resilience. These include our churches and our elders and those grassroots activists, as well as mutual aid networks. They often step in where formal systems fall short, providing food or childcare, housing support, and emotional or spiritual care. Informal leaders may not hold official titles, but they command trust and exert significant influence in the daily lives of this community. When we look at the patterns of influence and control, we can see that formal leaders typically impact change at a systemic level, while the informal leaders drive change from the ground up. Both groups interact with one another, often reinforcing or challenge one another's approaches. For example, mutual aid networks can address the immediate needs, while policy-focused organizations work to remove the structural barriers for the long term. And then finally, in terms of service delivery, the pattern is largely community-driven, but it's uneven. While informal networks provide critical lifelines, they often lack consistent funding and resources. While the formal systems, meanwhile, may offer broader systems, they're not always accessible due to systemic inequalities and discrimination. This creates a dual reality, one of resilience and innovation within the community, but also one of persistent gaps in equity and access. To truly understand a community, we must listen to its members. When we talk about community perspectives, it's important to center the lived experience of Black women themselves. The city and county where I live has a very low population of Black women, and when interviewed, I posed the following questions. What challenges do you see? What strengths do you notice? What needs more attention? All of these questions are essential guiding questions for social workers. They're guiding questions for researchers and the community advocates. So one of the most urgent challenges that we established here from our community perspective is healthcare discrimination. And this is true everywhere, not just my community. Research consistently shows that Black women's pain or symptoms are often minimized by providers, leading to misdiagnosed or delayed treatment. In maternal health, This is particularly dangerous because Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. We can also mention employment inequities as another significant barrier. Limited access to stable, well-paying jobs affects healthcare access. It affects housing stability and overall family well-being. And without structural changes, cycles of poverty and limited access to care just consists and persists. I have established some strengths, though. Despite these barriers, the resilience that I mentioned that you'd hear a lot of, and unity of Black women are so profound. Many communities draw power from cultural identity, mutual support network, and advocacy, but the Black women have historically been at the forefront of this, of social justice and health equity movements, which is a strength we should both recognize and amplify. And in terms of needs, what clearly needs more attention is systemic reform in healthcare. Addressing provider bias, ensuring equitable access, and listening to Black women's voices in shaping healthcare policies are critical. The maternal mortality crisis cannot be solved without structural change. And employment equity also requires intentional policy changes, such as fair hiring practices, workforce development programs, and addressing workforce discrimination. So let's frame the problem by first looking at our knowledge base. We're going to kind of review Black women face significantly higher rates of chronic illnesses, including hypertension, diabetes, and maternal morbidity, while also experiencing lower access to quality health care compared to white women. And this is reported by the CDC. Structural racism is a key explanatory framework. Social work and public health research point to discriminatory policies, implicit bias in healthcare, and unequal economic opportunities as major contributors to these disparities. And to frame this problem, I draw on Kimberly Crenshaw's framework of intersectionality. Intersectionality shows us how overlapping systems of oppression like the racism, sexism, and classism combine to create unique disadvantages for Black women. I'm going to talk a little bit about my working hypothesis in the next slide, but to give you a heads up, it is kind of, I believe, the issues such as the maternal mortality crisis among Black women is not a matter of individual health, but a structural issue. It results from systemic racism, inequitable healthcare access, and biases within the medical system itself, and I can't say that enough. By framing it this way, we recognize that solutions require systemic change, not just individual intervention. Again, this is not solely a matter of individual health behaviors or personal choices. It is a structural and systemic issue. The persistence of racialized health disparities indicates that the problem lies within the institution itself, healthcare providers and their biases, and inequitable economic opportunities. By framing it this way, we move beyond fixing the individual to transforming oppressive systems. So, back to my working hypothesis. If social work practice and policy advocacy intentionally center the voices of Black women while addressing provider bias and structural racism in healthcare and employment systems, then health disparities can be reduced, resilience can be amplified, and more equitable outcomes are going to be achieved. As a future social worker, I know that strategies for change must be multi-layered. On the policy side, advocating for maternal health equity legislation is critical, and partnerships with organizations like In Our Own Voice and the Black Mamas Matter Alliance exist to strengthen advocacy efforts by centering the voices of Black women. On the practice side, social workers must commit to culturally responsive and trauma-informed care, ensuring that Black women are affirmed and respected and empowered in service settings. Combining policy advocacy with direct community engagement is what will provide the best chance for sustainable change. So to wrap it up, I want to thank you for participating in this presentation. I also would like to give some special thanks to the Black women in my community who have helped me out with this presentation. Like I said, I haven't been in this community very long, so I do not know a lot of Black women, but I've had the pleasure of working with some in the residential treatment facility that I worked at. And all the women I spoke to were amazing individuals. And because they are clients or former clients at our agency, due to privacy concerns, I'm not unable to share names or faces. But again, I am so grateful for the time that I spent with them and getting insight onto who they are as Black women in the United States and within my community. Thank you.